Sarah, I'm Taylor. I'll be your OT today. So I understand that you just had a hip replacement and it's impacting your right side and you need a little extra help with seated bathing, so I will teach you how to do that the safest way that you can. And before we do that, I just want to remind you of 3 things that your doctor mentioned, which is to make sure that you keep your legs spread apart, don't turn your bad hip in towards your knee, and whenever you're bending, keep your knee at the level of your hip or below. That way you can keep that safe and you don't hurt it any further. So whenever you're getting into the tub, you'll want to go close to where you can get a grip onto something. I see you have a bar here. So you'll step in with your good leg, and then once you get in there, you'll bring in the bad side. And then you can back up until the back of your knees touch the chair, and you'll reach back and sit gently. So once you're actually sitting, you can turn the shower head away from you and turn the water on cold first, that way you don't burn yourself. And after you feel a comfortable temperature, you can bring it back towards you and grab the washcloth and the soap, and you can begin washing yourself. Because you have to remember to keep your knee at a certain level, it might be a little harder to get below your knee or the back of your legs or your feet. So I understand that your husband's around, so if you need a little help with that, I would ask for a little guidance or assistance. Now, to make this easier, you could keep the soap on your chair right next to you on the rag, or you could even bring the shower head down closer to you. That way you don't have to reach as much or twist as much, because everything will be right next to you, and then you could just use it as needed. But if that's too easy for you, we can hang that back up there, put the soap back, washcloth in a safe spot, and you'll scooch towards the edge of your chair, and you'll push up from where you're sitting, and you can stand and you can bathe standing. That way you work a little more on your balance and strength with your hip replacement. So to get back out of the shower, we'll do basically what we did to get in, but we'll have to turn towards the other side. So it's important to get a grasp on your chair so you have a steady surface. You'll go close towards the edge of your tub. You'll step out with your good leg, and then out with the bad side. And I hope that helps.